There's a particular kind of cruelty that hides behind a paycheck, and the young women who walked through the factory doors of the United States Radium Corporation in Orange, New Jersey, had no reason to suspect what was being done to their bodies because they were earning good wages, more than most women could dream of at the time. And the work was considered clean and respectable. And the company had told them the luminous paint they handled every single day was completely safe. The company knew this wasn't true. Radium in the early 1920s occupied a peculiar place in public life. It was packaged as medicine, sold as beauty cream, and a tonic called Radithor, essentially radium dissolved in water, was promoted as a health cure and consumed by wealthy Americans until one of its most prominent users began developing serious bone deterioration. While physicians recommended radium treatments for arthritis and fatigue, and the element appeared to glow with some exceptional vitality that most people in that era read as a sign of life rather than death. And this cultural backdrop gave the radium companies remarkable cover because the factories didn't hide the radium from their workers. They put it in their mouths. The factory floor itself was an extraordinary sight, where dozens of young women, many of them teenagers, sat in long rows painting clock and watch dials with a luminous compound sold commercially under the name Undark, trained in a technique called lip pointing, in which they pressed the brush against their lips before each stroke to maintain a fine point on the bristles, performing this action hundreds of times each shift, every working day for years. Until when they walked home in the dark, they glowed, painting their fingernails with the substance in their teeth and their faces, while the factory floors shimmered at night and the women called themselves the Radium Girls, with no way of knowing that the light on their skin was the mark of what was slowly killing them. The radium entered their bodies with every brushstroke and every lip point and every breath of factory air, settling into bone tissue through the same mechanism by which the human skeleton absorbs calcium, drawing the element deep into the hard structure where it begins to destroy from within, in a process that is not quick but extraordinarily slow. And the company's scientists understood precisely what radium did to living tissue, having reviewed the same research that existed in laboratories across Europe and America. While the executives had access to that data and made a calculation, the profits were considerable, the workers were replaceable. And what you call a company that knows it's killing its workforce and continues anyway is a question the legal system would eventually be forced to answer. What followed was one of the most significant legal battles in American history. A story of institutional betrayal and deliberate suppression of evidence built around a small group of dying women who refused to disappear quietly. And the full account doesn't appear in most standard histories because the industry and various government bodies worked in concert for years to keep it buried, with the companies holding resources and connections while the workers held the truth, which at that particular moment was worth considerably less. Symptoms began appearing in the early 1920s. Dental problems first, then unusual decay and infections that wouldn't heal, and jaw pain that became severe and then catastrophic. And when a young woman named Amelia Maggia died in 1922, the official cause of death on the certificate signed by the company's physician was syphilis, a false diagnosis recorded deliberately to protect the company's interests, when the real cause was radiation necrosis, radium having eaten through her jawbone from within. And when investigators eventually exhumed her remains and tested them, her bones still glowed. Other women followed in the same terrible progression. Grace Fryer developed serious bone damage as her spine began to collapse. Edna Hussman lost multiple teeth and then portions of her jaw. And Catherine Schaub endured years of deteriorating health that no physician in the company's orbit would correctly diagnose, because the company had been systematically pressuring its affiliated doctors to attribute the symptoms to other causes, to industrial anemia or general decline or overwork, to anything but radium. while the company wasn't willing to look at how many women had to die before the pattern would be formally acknowledged. The company retained a Harvard researcher named Cecil Drinker to conduct what was presented as an independent health study, and his findings were unambiguous. The workers were being poisoned, but the company took his report and rewrote it, turning a document that condemned their practices into one that cleared them entirely. And when Drinker discovered what had been done, he was furious, though the cover-up was calculated and thorough, and there's a reasonable question about whether the executives genuinely believed this would remain buried, because it appears they thought it would. Grace Fryer eventually found a lawyer willing to take the case after several had already declined, and Raymond Barry agreed to represent 5 of the women: Fryer, Hussman, Schaub, Quinta McDonald, and Albina Larice, in a civil suit filed in 1927, with all 5 plaintiffs in serious physical deterioration and running out of time in ways the company's attorneys understood very well, having calculated on that possibility quite carefully. And one legal strategy was pure delay through repeated requests for postponement based explicitly on the chance that some or all of the women might die before any verdict could be reached. The public began paying attention as reporters covered the proceedings, and the image of 5 visibly ill young women watching their case postponed week after week while corporate attorneys maneuvered in court generated outrage the defendants hadn't anticipated, with the women giving interviews from their sickbeds and being photographed so the public could see their faces. And the dial painters who'd once glowed with radium were now illuminating something powerful men had spent years trying to suppress. The New Jersey Industrial Commission pushed toward settlement, and in 1928 the company agreed to pay each plaintiff $10,000 plus $600 annually for the rest of their lives plus all medical costs. A settlement rather than a verdict, with the company admitting nothing. And several of the women had to be carried into the courthouse on the day the agreement was finalized, while one couldn't hold the pen to sign her own name. And the company's representative sat across the room and watched. The settlement made the case impossible to suppress any further. And the name, Radium Girls, entered the public vocabulary as the debate that followed expanded beyond this one company and this one substance to whether corporations could be held accountable when they knowingly poisoned the people who worked for them. A question that wouldn't be answered quickly or simply or without the deaths of many more workers in many other industries running the same calculation across the same century. The women in Illinois had a longer and darker road, as the Radium Dial Company in Ottawa deployed more aggressive legal tactics. Campaigns to discredit the science being used against them, efforts to suppress worker testimony, sustained attempts to intimidate women who came forward. And Catherine Wolfe Donahue, who'd worked at the Ottawa facility for years and developed the same devastating progression of symptoms, gave her testimony before the Illinois Industrial Commission from a stretcher while the company challenged jurisdiction at every turn. And she died in 1938, but not before the commission ruled in her favor in a decision that established precedents in occupational disease law that would stand for decades. The full weight of what the Radium Girls cases produced is difficult to overstate, as they helped establish the legal frameworks governing corporate liability for occupational disease in the United States, while the medical research conducted on their bodies contributed foundational data to the science of radiation exposure, informing safety standards for nuclear workers and medical personnel, and everyone who'd later work with radioactive materials during the Manhattan Project and well beyond it. And these women dying in courtrooms and sickbeds helped protect generations of workers who'd never know their names existed. The United States Radium Corporation eventually became the Safety Light Corporation, and radium contamination from its New Jersey operations spread into surrounding neighborhoods and deep into the soil beneath them, with cleanup efforts stretching into the late 20th century. Because the ground itself retained the evidence long after the last dial painter was gone, which is perhaps the most fitting testament to what was done there. The poison outlasted everyone responsible for administering it, and everyone paid to deny it. What the executives understood and chose to act on anyway was the arithmetic of disposability, because the women could be replaced and the profits couldn't be interrupted and the science could be managed and the lawyers could buy time. And this calculus wasn't unique to the radium industry, but has appeared in asbestos litigation and tobacco cases and pharmaceutical scandals and industrial poisoning disputes across the country and across the century. Because the radium girls weren't the first workers treated as expendable. They were among the first to drag the men who treated them that way into the light. The bones of some of them still glow,